Let's talk about glaucoma treatment from least invasive to most invasive. Invasive is a term that we use in medicine to basically describe how much of the tissue is really going to be disrupted in the process of the treatment. So eye drops are the least invasive way to treat glaucoma, and many patients who have an initial diagnosis of glaucoma will be put on eye drops. Another really common therapy as initial treatment is SLT laser, and there's a whole other video on this channel all about SLT laser, so I suggest you go check that out if you're looking into it. But SLT laser is also safe, but it is considered to be more invasive than eye drops. However, eye drops are long-term chronic medications, so if that's not something that you want to do, SLT laser might be a really good option for you and could save you the sort of hassle from being on eye drops for a number of years. So what happens after you have been on an eye drop, or maybe you've already had laser? What happens at that point in time if your glaucoma is still not well controlled? Usually the eye doctor will just add another medication. So just like how high blood pressure has multiple different types of medications that can be used, and sometimes patients need to be on multiple medications to control their disease. For high eye pressure or pressure that is just not responding to a certain medication, we may need to change the class of medication or add an additional medication to get the pressure at a level where you're not actively losing vision. So let's say, unfortunately, drops are just not doing it, or maybe you have a visually significant cataract that you need cataract surgery for anyways. So there is a type of surgery called minimally invasive glaucoma surgery that can often be done in conjunction with cataract surgery. We often call these MIGS for minimally invasive glaucoma surgery, and these MIGS procedures can usually be done with cataract surgery, and there are some MIGS procedures that are approved for use without cataract surgery. Now, MIGS procedures are great because they can lower the pressure, and they are, as the name says, minimally invasive. For some patients who have MIGS procedures done, they may get enough pressure lowering for a really long time that just means that they may have to go back on some drops, or maybe not have to go back on drops at all to control their glaucoma. For some patients, however, they may need to have more invasive procedures done at some point during the course of their disease. In some situations, a MIGS procedure will not be enough, and even after adding in additional glaucoma drops on top of the MIGS procedure, it still may not be enough for some patients. And in those cases, those patients may need to have further surgery. Another type of surgery is a tube shunt, and then there's also another surgery called a trabeculectomy. These surgeries do lower pressure dramatically, but they are more complicated than the procedures mentioned before, and they can have a more complicated post-operative course. Now, in most cases, doctors will go stepwise from least invasive to most invasive, but this is not the case with everyone because everyone's eyes are different and everyone's disease course is different. So if there is a patient who has a really aggressive disease and aggressive vision loss, they may be more warranted for something more invasive sooner. There is also an oral medication called Diamox or acetazolamide that many doctors will use to lower pressure in patients. Oftentimes, this is not really used as a long-term solution, but in a handful of patients who tolerate it well, it can be used. If you have any questions about glaucoma treatment, be sure to drop it in the comments below, and don't forget to subscribe and like this video. See you next time.